Hi, my name's Phil. I like talking about politics, and in this video, I'd like to discuss the decision by our nurses to strike over pay, including putting in perspective just how much the government have squeezed them over the past decade, to the point where many can't even afford the basic cost of living. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, in a sense, nurses voting to strike is just the latest in a line of professions who've been pushed too far, but it also highlights just how disingenuous the Tories are. In 2010, they all hijacked what was a well-intentioned show of support for our frontline healthcare workers. You know, they went out each week and they clapped for the NHS. Some even banged pots and pans to make themselves even more obnoxious. Of course, what our frontline healthcare workers wanted was resources. They were deprived of vital PPE and mitigations against a deadly and chronic disease. As a result, on top of the underfunding of the service over 10 years, they were overwhelmed with a much higher number of COVID sufferers than should have been the case, and were poorly protected themselves. So there's now a very serious long COVID problem in the NHS. And if we look at nurses for the purposes of this video, though it applies to paramedics, therapists, doctors and others as well, but for nurses, look at the situation. Because NHS resources have been squeezed so much, including pay, those who remain are overworked. To give an idea about pay levels, I gather the starting band for registered nurses is band 5. So a newly qualified nurse, when the Tories took over in 2010, was getting £21,176 per year. When you put that through the Bank of England's inflation calculator, that is equivalent to £29,308 today. Is that what they're getting? No, they're getting £27,055. That is a real terms pay cut of 7.7%. The Tories have actually reduced the pay of nurses, and that's newly qualified nurses. The government are actually more generous with the bottom of the scale because they want to attract people into the profession and hope that they're then trapped in it. At the experienced end of band 7, for example, they used to get £40,157 2010. That is the equivalent of £55,578 today. But they actually only get £47,672. So that's a real terms pay cut of 14.2%. And it's not exactly like nurses were living on lobster thermidor and caviar under Labour. This is why nurses, especially the less experienced, and those living in the more expensive parts of the country, are really struggling. More and more even need to use food banks. Just like many other key workers who people applauded a couple of years ago, they don't know how they can afford the bills unless there's a crap load more money coming into the household from someone else. And this squeeze on pay meant nurses left the NHS. Maybe for other jobs in the UK, maybe for nursing jobs elsewhere. But because they left due to declining pay, it's not a straightforward task to replace them. Indeed, the government didn't really want to replace them. They like to talk about their targets for recruitment. Oh, you'll never shut Tory MPs up when they talk about their targets for recruiting here, there and everywhere. But the deficit remains, and the deficit between the nurses we have and those we need just widens. This means that nursing teams are short-staffed. And it's much harder work for those remaining. They get overworked and undervalued. On top of that, the problems of too little pay, malnourishment, mental health problems caused by stress over the impossible cost of living decisions, and the effectiveness of a nurse now can't be what it was 12 years ago. How can it be? They're stressed and not eating properly in many cases. And as soon as they voted for the strike, those same people who insisted that people go out every week and clap for them as if that did anything, they're now turning on them. Oh, you'll hurt patients with this, they say. Now, what hurts patients is not having enough nurses. What hurts patients is having your too few nurses unable to look after their physical well-being with a healthy diet or their mental well-being with a secure domestic life. That's what hurts patients. And it's been hurting patients for many years now. This is apparently the first national strike ever organised by the Royal College of Nursing. That in itself should tell you something. This is not a profession who strike habitually, and it's not a profession that's greedy. There are better paid, less stressful jobs out there for the same level of training required. And the Bank of England keeps pointing out we've got more vacancies in this country than people to fill them. The bottom line is the government have been paying nurses less and less since they came into their office. And at the very least, the government needs to bring pay back into line with 2010, and even that would make their jobs harder than it used to be for no greater reward because of the terrible shortage of tens of thousands of nurses. But the government will resist, not just because they always resist letting ordinary workers earn more. There's more to it here. They've been deliberately undermining the NHS ever since they came to power with the deliberate intention of crushing it. You can see that some of them think they're getting close to endgame here. Very, very close. When the Tories won in 2019, one of the things I said that's probably too late for now is the NHS. I said that's probably it done now. Over the past year, I've seen a definite increase in the number and frequency of right-wing commentators saying that the NHS is broken, can't work, it's completely rescuable, needs breaking down and building back up to make it work. There's a real concerted effort to push that onto people. The government have kept reducing the funding for the NHS to the point where it cannot provide the service it should, but also can't even get the staff to try. But at the same time, they claim to be pumping record sums into the NHS. Oh, they'll show you their graphs. Look, we keep pumping more and more into it. But it's lies. It's not going into the NHS. What they're doing is pumping record sums of public money into private healthcare. And they're calling it NHS funding. And the way they get away with it is they force the NHS to contract out services. So the money goes into the NHS and then funnels straight out again. Now, it's one thing for the government to pay for private healthcare with public money if you need extra capacity, if you've got to get that extra capacity for whatever reason, although then you should be asking why the publicly funded capacity wasn't there. But it should not be counted as NHS funding. If the government were made to distinguish between healthcare spending on the NHS that stayed in the NHS and that on private healthcare which the NHS is forced to contract out, they would not be getting away with this. But the government present their figures exactly as they like. It's a deliberate strategy to break the NHS so that they can give away its constituent parts to private investors. Not sell. People keep saying, oh, the government are trying to sell the NHS. No, they're not. They don't want to sell it. That's too much effort. They just want to give it away. And this deliberate policy of breaking the NHS is not only causing unnecessary suffering for those of us who need medical attention from time to time, but also the people who provide that care, with nurses currently the ones in the firing line by the same arseholes who made a show of clapping them 2 years ago. But according to the Nuffield Trust, 1 in 9 nurses left the NHS in the first half of 2022 alone. In the first half of 2022, a ninth, 1 in every 9 nurses we had at the start of the year was gone by summer. And this won't just be retiring nurses. That will account for some of it, of course. But it won't just, and actually some of the retiring nurses I suspect are doing earlier than would otherwise have been the case. Needless to say, this is by far and away the largest number of nurses leaving the profession in the first half of any year since the Tories came to power. A big old jump up this year. And that, of course, is because of the extra squeeze on the cost of living. They've had their pay squeezed over 10 years. And then all of a sudden, with the very high inflation, it's just gotten out of control. You know, there's an even higher proportion of NHS staff across the board leaving. That's even higher than for nurses. So I expect the government to resist a lot here. You know, I think they can sense the end of the NHS. I think it's close. And they can only have a couple more years to make it happen. Not that a fair pay offer will suddenly snatch their victory from them. I suspect that nurses would still accept a lower overall pay offer than their equivalent 2010 pay levels, meaning they'd still be worse off under this government and their working conditions will remain poor even with a decent pay offer. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.